those benefits is a war. I mean, it's a war. I can tell you from experience. Once they're accustomed to what they got, it's pretty hard to take it back. But there is some reasonableness in what you're saying. We went through an educational process with our members as to really what this provides for you. And we do have contracts that share costs. Depends upon what the employer can pay, what he can afford to pay. We look at it all because we deal with different levels and different experiences with employers on what they got. There is a social obligation of all employers to provide the best benefits. That's my feeling, and I think I heard that out of you too. You were all recognizing the social responsibility of an employer back to the community, not only to its employees, but it goes far in the community when an employee and their family has good benefits. You say they had the highest reported cost in the U.S. here at TriMet? Ours average $1,000 per member. You know, our contracts, we have a few a little lower, but the benefits are lower. But our Cadillac, we call it a Cadillac plan, costs $1,000.
And that's an average across employees. I was quoting the cost for family coverage. So that would obviously bring it down.
Yes, ours covers the family.
Does it cover everybody?
It covers everybody, whether you have 10 kids or 1 kid, or, you know, and just one last comment, Madam Chairman, is two-tier systems don't work. We have great experience with it. We went in our grocery industry. Bob's familiar with this from his experience, and years ago we negotiated, and we did not like it, but we said, okay, we'll try this. We'll go through a contract. The employees became disliking each other. There was one employee saying to the other, well, you get a little more than I do. You can work harder than I do. It caused friction inside, and productivity was actually lost. And in the next contract, it was the employers that came back and said, we want to remove a two-tier system. It's been tried, and it's not a good thing. It doesn't work out. It's better to keep employee benefits the same and equal, whether you're a new employee or an older employee. And retiree costs, I'll finish on that. I don't mean to hog it, Madam Chairman. Retiree cost is the one that kills all our program. Not kills them, but drives them up. But I would say back to you all as a committee, get in the political forum on this. But there's a ripoff on this in the pharmaceuticals and in the medical industry. We're not the cause. You are not the cause of the rising costs. Not all of it.
Clearly not.
No.
And that's one of the challenges that we faced in trying to make recommendations, because in many respects TriMet didn't bring this on itself.
Exactly.
These are issues facing all employers. But we just felt it was important to look for new ways to do this.
And I think you have. You said it very well. Thank you.
Thanks, John.
Yeah, Cynthia, I know the committee's charged with looking at employee benefits, but I'm just curious, did you look at doing a total compensation comparisons? Because as you probably know from your background, once you start looking at individual costs relative to what a company is providing, it sometimes gets distorted. You know, some companies have great salaries, low benefits, and sometimes high benefits, low salaries. Or did you do any total compensation?
We didn't do analysis, but we did have some statistical data, and when we looked specifically at pay, we were looking at hourly operator wage rates, and TriMet ranked 21st out of, I think, about 96 transit agencies across the country.
So we're up there.
Yeah, I mean, you're in a respectable position. So that was actually, when we saw the costs on the healthcare side, that was the first place we looked, thinking, oh, well, there's been a trade-off here, but maybe that's not the case. Maybe there's some room to adjust the benefits. It's our understanding that the current contract's been in effect terms were different, healthcare costs were different.
I really applaud your work and the work of your committee, and I totally agree with everything you said. And I hope that management is what you're saying, and that it's good to know that there are other public entities in the city, and one of them heard reported a handful of others that are looking at this the same way, quite honestly, private employers are looking at it. And the notion that just cutting service is the only option, and that people who actually, everyone who works at such a wonderful organization like this have to feel some of the hurt as well. And so it's happening in employers, private employers all over the city and region and country. So I applaud you for being bold and telling TriMet to be bold. So I agree with you.
I really agree as well. Looking at just from the private side, my own self, with our employees, we have a generous plan as well, but it may be timely to be looking at some of those changes now, as hard as it may be. So I also thank you for bringing it up, and I know it's great for you. So, Bob?
Oh, I thought you wanted.
Lynn touched on most of the things. Two union reps sitting next to me. I should say ex-union rep. But one of the hard things is to get people to allow you to take away what they have experienced for a long period of time. And so, barring them becoming negative, I think you're right in saying that something has to happen prior to the negotiations, i.e., the heads need to get together and try to come up with some way that they can get the body to understand how serious the situation is, and that everyone has to play a role in maintaining. And I forgot about that ASME experiment, but that would be a good one for this agency, to have a meeting with some people and have them stand and understand who's not going to be here. Look around, because that person might not be here. And then it gives you a sense of being and a sense of understanding. So I compliment all of you on your presentation, and we heard you. And we don't. One of the things I can say is normally we don't interact as much as we have today, but because of the times and the things that you were saying, it touched on. Thank you.
Can I add just one thing on the retiree? Because I say, and that's for everybody. You got to get involved. But retirees retire on less than what they make. Most of us. We don't have the luxury of retiring at full pay. But it is important for all of us to remember that we got to take care of the retiree. It's easy to give away somebody that's not here. They're gone. I mean, not easy. But we have an obligation to the elderly in this country that they retire in dignity. And they didn't drive the cost of health care. It was driven up for them. And we can't discard them. We're going to have to find a way to still afford to give them that kind of retirement. And the cost is high for a retiree. There's no doubt about it. But what do? Not give them coverage? Them are our parents and our relatives that are doing that. So I think we got to get all of us involved politically to get this problem solved. So
if I could just embellish on those comments, I agree. And it gets more expensive as you age.
Right.
Not only to buy coverage, but to consume services and pay the amounts that the patient is asked to pay. But one particular opportunity that may exist is for the retirees who are over age 65. I mentioned that I do a lot of work with seniors.
Sure.
I'm a volunteer with the State Health Insurance Benefits Assistance Program, and I counsel retirees and others on Medicare once a week. And